Good afternoon, everyone. I'm Chris Brown, your state senator, and I want to welcome you to this week's information uh, briefing on what's going on here in Atlantic County and how it affects us all and our families. I'm joining you once again because I believe it's important we do everything we can to share as much information to help all of us get through this time. If you are listening now and you know someone who may benefit from the information we'll be talking about today, please share it now on Facebook Live. Also, I want to thank Scott Cronick and AC Mike Lopez from WOND who have been replaying these conversations on their shows. Shout out and a thank you to WOND for being live and local. I want to thank our volunteers here, three in particular. Summers Point Councilman Jim Toto, he's been outstanding, and his concern for everybody is amazing, as well as Carol Monday and John Farinelli, and of course, Linwood Councilwoman June Burns and her son Jackson. They come in and they've been helping us deal with so many families who are devastated by not just being laid off, but then a broken unemployment system. We train them up. They then help everybody get through the process. If anybody out there would like to help and would like to volunteer for other Atlantic County families, we certainly could use the help. Our number is 609 677 8266. And also, after our conversation today with our guests, I'll provide some updates on a few important issues, so stay tuned. So, getting right to it, we will be having a conversation with our guest from AtlantiCare, Debra Fox, Vice President, Strategic Planning and Partner Integration, and Jim Kilmer, Vice President and Chief Administrative Officer at AtlantiCare Regional Medical Center City Campus. We're afternoon now, so good afternoon, Debra and Jim. Thank you for joining us.
Good afternoon.
Good afternoon.
So, how are you and the staff at AtlantiCare doing?
Senator Brown, thanks for having us on. First of all, I said we're doing really well. We're really proud of our dedicated staff and the work that they have done throughout the pandemic. It's been a long run since the beginning of March when we started to see some patients here at AtlantiCare, but we are really grateful for our dedicated staff. It goes across all levels of our organization, but we're also really grateful for the support from the community. It really takes a village to work through a situation like this as a worldwide pandemic, and we've had some tremendous support from the community. We've been sharing our appreciation for our staff through a lot of social media stuff at AtlantiCare and our hashtag AtlantiCare's Got This campaign. So
Well,
our staff is resilient.
may I just throw this in real quick, because I'm gonna put this information up in the comments section so that people listening or viewing this will be able to show their appreciation as well. So if somebody hears this and they'd like to let the nurses and the doctors and the administrative staff and everybody who's done such a great job at AtlantiCare know that they appreciate them, what would they do on social media? Is there a web page? Is there a Facebook page, a Twitter site?
We have a Facebook page at AtlantiCare that they can post comments there if they'd like.
Okay, so they should go to the Facebook page of AtlantiCare, and that's the best opportunity. Now, you mentioned hashtag. Tell us a little bit about what that is.
It's just a campaign that our marketing department has put together that we've been sending out videos and pictures of the care team and providers throughout our response to COVID-19. And that we just tag it hashtag AtlantiCare's Got This when we send out those types of videos and pictures of our staff.
Well, that's awesome, and I'm sure your marketing team will be glad you mentioned it. And so I know, Debra, you in the same one in accord with Jim?
Yes, absolutely. Absolutely. And thank you again. I'll echo Jim's thanks for allowing us the opportunity to speak with you today and share our messages with the community. Yes, we're also on Instagram, so that's another place where people can go and use this hashtag and be able to see what we're doing with our employees. We've been able to share a lot of the support that we've gotten from businesses in the community, like the Village Supermarkets and ShopRite. They've been tremendous to our organization. And I'd be remiss not to mention that there have been many, many individuals, young people, all ages, families that have reached out, helped provide meals and other things for our employees, and they could not have been more appreciative of all of those efforts. So we share those things through our social media sites.
Well, that's awesome. And I know on behalf of all the families here in Atlantic County, I've spoken with the leaders of AtlantiCare as well, and have had an ongoing conversation, as well as even Shore Memorial, and let them know on a regular basis the appreciation that I have for what they're doing, and the appreciation that I have for the doctors and the nurses and all the frontline staff. It's been said so many times, but really you can't say it enough, because every day they're out there and they're doing it. So this is an opportunity to publicly thank them as well. I guess we'll start with you, Jim, if it's okay. Could you share with our viewers your background and your role at AtlantiCare?
Sure, thank you. I actually am in healthcare for over 30 years now. I actually got started in my career as a radiologic technologist, and then worked my way into different leadership roles. My current role, I am the administrator for the Atlantic City Hospital, so I have overall responsibility for that operation, but I also have administrative responsibility for AtlantiCare's emergency preparedness. So obviously that's been some of the work that we've been doing over the last several months. Normally, when we have emergency preparedness, we're preparing for a snowstorm or a hurricane, and never such a long run like we've been through this pandemic.
So you've more or less had your fingers right on the pulse in terms of the stress and strain that it's placed, ebbed and flowed on our healthcare facilities.
Yeah, I was more or less like the conductor. I have a great orchestra out there that was helping with the response, and we just try to really manage it and keep it all coordinated, make it a coordinated effort.
And how about you, Deborah? Could you give us a little bit about your background and role at AtlantiCare?
Yes, similar to Jim, I have many years in the healthcare industry, over 30 as a matter of fact. A little fact I'll add is I was actually born at the hospital in Atlantic City.
What, really?
Yes, I was.
So my dad, myself, and my children, or my daughter, was the last birth in the hospital in 1999.
Wow.
It's kind of neat, right?
That's very neat. So, working at AtlantiCare has been near and dear to my heart. My family still lives in the community. So after college, I went right back to Atlantic City, at that time, Medical Center, to work. My background is laboratory medicine and pathology. So, it's been interesting to see this not only from the leadership and safety management perspective, but also from the science of it. And I spent many years of my career doing emergency management and safety, as Jim is doing now. So I appreciate the tremendous job that he and the team has done. And my current role is the Vice President for Strategic Planning. So I work with the leaders throughout the entire organization, as well as our Board of Trustees and community-based committees and other community members, to help develop and execute our strategic plan for the organization.
Well, that's phenomenal. And I knew part of the reason I knew we were lucky to have Debra and Jim with us today, is I knew these credentials in the background, but I thought it was important that everybody listening understand that this is the real deal. You're talking about people combined over 60 years and experts not only in emergency management, but also in pathology and a lot of the core issues that we're dealing with right now. So we're very lucky to have this kind of talent and have that talent in a position that matters. So I guess I'll get right to it. I've gotten different questions from people who write in and they know that we're going to be speaking with you. And the first one goes, with the phased reopening in our state, uh, people would like to hear what you have to say and believe it will be helpful to review AtlantiCare's and our efforts to flatten the curve over the last few months, which ultimately it's been this hard work that's put us in a position to open up. Either Jim or Debra.
Yeah, I'll start with that, Senator Brown. So, and again, the whole response has been very fluid. I think the nation has been learning on a daily basis as we respond to COVID-19. We're very fortunate to have a great group of internal experts around infectious disease who really look at all the latest information from the Center for Disease Control, the State Department of Health, and all of the best practice science-based data that's out there that helps really drive what we do. I think in South Jersey, I think when the governor did put the physical distancing in place, I think we were probably a little bit ahead of North Jersey and the New York area as we had less community spread. So I think that added to our advantage of keeping the curve down. But throughout the pandemic, the other thing we learned that each and every one of us, the healthcare providers, the community, we all play a role in this. And the biggest things we really stress are the hand washing and the mask wearing really make an impact on keeping the curve down and not overburdening our hospitals.
And Deborah, do you have anything to add about your efforts through AtlantiCare or AtlantiCare's efforts to flatten the curve?
Yes, I'll just piggyback on to what Jim said. He spoke about community, and I think it's important to know that we've approached this not only as our own sort of standalone organization, but also working with the other healthcare organizations in the community to make sure that we were speaking with them on a regular basis and learning from each other and aligning our best practices and what was going on in each of our organizations to be able to better manage things as a healthcare community, which in a pandemic situation, I think best serves the greater good of the community. So our CEO, Lori Herndon, was in constant contact with the other local healthcare organizations to keep those conversations going in order for us to approach this to best serve the entire community.
Well, one of the things people are sharing and you hear, but you don't really get the right answer, or you don't know if anybody knows what the heck they're talking about sometimes. And so one of the concerns our families are sharing is the possibility of a spike or a second wave. How is AtlantiCare preparing for the possibility of a spike in infections?
Well, Senator Brown, I'll start with that, I guess. Our emergency preparedness is not a one-time process. We have some very detailed plans that we review and revise on an annual basis. And part of those plans are responses to influenza-like illnesses or pandemics. And they also include pace and surge. So we're always preparing for that, revising those plans on an annual basis, and making adjustments as we go along. I think we still, until we get to a vaccine, there's still, as we get into the winter flu season, we're probably going to see an increase, but we've learned a lot Since we started this, some examples in the hospital, we have dedicated respiratory care units now that are dedicated to the care of our COVID-19 patients. So we're much better prepared. As far as our personal protective equipment, we are planning for the future and stockpiling items that we need for our next response. For the initial response, we had PPE stockpiled and ready. We did have some challenges at one time when everyone else was having challenges with isolation gowns, but one of the great things our procurement department did, we partnered with Spencer Spirit Holdings, and actually they came in and custom made disposable plastic raincoats for us that were a little bit wider, a little bit longer in the sleeves, and a little bit longer in length, that actually served very well as isolation gowns for us, and got us to a point where we can wait for our next shipments to come in. So we've done a lot of work around that. It's been a great effort with a lot of the partners in the community.
And Senator Brown, there was another organization in Mays Landing, Mahogany Company, that sort of re-engineered their business, which did some work historically in the marine, aerospace, and wind energy market sectors, that were able to make and donate face shields for us. And then in addition to that, there were also individuals, again, the power of the individual, that were making cloth masks and other things that we were able to use in our own organization, and where we didn't have a need, we were able to donate them to other municipalities, for first responders who may have needed to have that. So as Jim said, even though this has been a bit of an unprecedented pandemic, we have had a long time model around doing emergency preparedness and planning. So a lot of the things that we have done over the years helped us to really effectively respond to this situation. And as Jim said, we are learning as we go, and every situation, there are different things that stresses your system that you can't possibly anticipate, and you do your best to plan. So, certainly our procurement team, and making sure that we have enough PPE, that is front of mind and first and foremost should any second wave of infection happen, and I believe we will be prepared.
Well, that's great to know, and everybody from Atlantic County once again should be proud of their neighbors, their family, their friends, because Atlantic County rose to the occasion, and whether it was small businesses working with you to make sure you have what you need, or individual families making the mask, Atlantic County came together and made a reality, and it's wonderful to hear you talk about that. So if I hear you correctly, you are prepared. We understand that as you gradually open up the economy, you're going to see a gradual an increase perhaps in some of the cases. And as it stands right now, if I hear everybody correctly, we have enough PPE for, let's say there was a beginning of a second wave.
That's correct, Senator Brown.
And I also been speaking with Ms. Hendren and Ron Johnson, and they also tell me we have enough beds right now and ventilator capacity and testing kits. What they told me is accurate, right?
Yes, it is accurate.
Yep. Yes, sir. I was just going to say that's something we've been monitoring, all of those variety of things from PPE to the ventilator capacity, the bed capacity, for a long time. And as you know, also the state did open up the alternate care site at the convention center as a way for decanting patients off the hospitals if we needed to, open up more critical care beds within the hospitals. And we were well prepared, but thank God never had to use it.
And that's just another example of everybody working together and being prepared. The greatest thing about the families here in Atlantic County, as both of you know, and you represent this as well, they love each other and they want to make sure our seniors, those over 60 as well, and I'm right at the corner of it myself, are protected, and anybody with an underlying condition is protected. And that's why I always stay in touch with your professionals to make sure that as we gradually open, the science and the data tells us we're not putting anybody in harm's way. So it's always great to hear it straight from you as well. I imagine there's a great deal of communication and sharing of information and monitoring particular health metrics among all of the hospitals across the state. Is that correct?
Yeah, Senator Brown, that's one of the keys to a successful response to an emergent situation is communication, obviously. We've had communication. The state is broken into 3 regions. We're the southern region, and we've been having daily communication with all 8 health systems in the southern region. We also, again, through NJHA, the New Jersey Hospital Association, have been inputting daily data around specific things like PPE, ventilators, etc. We're always in very close contact with Vince Jones and the Atlantic County Office of Emergency Management, and also our partners in all of our townships, the Office of Emergency Management in Galloway and Atlantic City and various other townships. So there's a lot of communication that really takes place to manage events like this.
That's really awesome. Anything, Deborah? It sounded like Jim covered it.
Yeah, the only thing, Senator Brown, that I would add is that we are also in very close contact with the Atlantic County Health Department. I've known and worked with Pat Diamond for many, many years, and they've been a tremendous partner as well. As you can only imagine, this has stressed their system as well. So certainly people communicating and collaborating at all levels of sort of the healthcare infrastructure is very important.
Well, I couldn't agree more, and I want to thank you and Jim and everybody there for doing it and making sure that we are prepared. It is reassuring as an elected person who is constantly on the lookout for the health and welfare of the people that I represent, particularly our seniors and those with underlying conditions. And to hear you, and it is reassuring to know that we are prepared with PPV, bed and ventilator capacity, and the testing kits. And another thing that both of you and AtlantiCare has been involved in that is phenomenal is you've been working closely with our casinos to help them reopen this week. Can you share with us how the process unfolded and what guidance you relied on to advise the casinos in making their preparation to reopen?
Sure, Senator Brown, this is Debbie. I'd be happy to do that. Being that we've been the healthcare provider in this area for over 100 years, we've had a long history of collaborating with our local and regional business and industry leaders. We've done some health and wellness initiatives and activities with those business partners in the past. But obviously, again, due to the unprecedented nature of this pandemic, the Casino Association of New Jersey reached out to us to assist them in preparing the protocol to reopen the casinos. And as I'm not sure if all of your listeners know, but the Casino Association is really a collaboration of all of the leaders of all of the New Jersey casinos. And while they have their own property-specific plans and protocols, they did work together to come up with one protocol that would be the minimum standard that they would all abide by. And we worked with them for many weeks and provided guidance that was from the CDC that we helped them to interpret in some circumstances, for our own best practices and sharing and researching things from the World Health Organization or from the New Jersey Department of Health or again from the CDC to best guide them in drafting their protocol.
So, in other words, AtlantiCare worked hand in glove with the lay people through the Casino Association to make sure that the plan was a good plan based on science and the best measures to prevent the spread of COVID.
Yes, that's correct. And additionally, several of them had reached out separately and wanted additional, more occupational medicine and occupational wellness types of services. So we've done some training for some of the properties just based on, overall, again, CDC guidance around the use of PPE, best practices for hand washing, disinfection protocols, how to best, take care of yourself when you're not at work, so that when you do come to work, you're ensuring that you're maintaining your own health and wellness to protect the safety of those around you.
And obviously, you wouldn't. In the end, you worked with them. You approved. You believe that this is a safe way to start reopening our economy.
Yes, I do. They have put safety first and foremost in everything that we have discussed. Safety for their employees and safety for their guests.
And Jim, I gather you agree with that, or is there anything you want to add?
Yeah, I do. And I guess the only thing I wanted to really add is we've had a long relationship with the casinos around emergency preparedness. We have memorandums of agreement for housing our staff if we have like a hurricane like Superstorm Sandy. We're also a part of Mutual Link, which is a video system that really links all the casinos, police, the hospital all together if there were ever an event that needed to be responded to at one of the casinos, that we all could really share videos, which is pretty unique. So we've had a pretty long-standing partnership with the casinos around emergency preparedness.
Well, that's the beauty of having professionals like yourselves who just further the relationship. And I think the most important thing for casino workers to know, for visitors who want to go to the casinos to know that it is safe, that this is not something that's been rushed, it's not something that hasn't been thought through, and that every step of the way it's been done with advice and consent of our medical professionals. And I can't thank you enough for the time and energy that you put in to make sure our families who work there are safe and to make sure visitors are safe. And that is part of the reason I have been advocating as hard as I have to uh, keep this moving in the right direction and let the science and the data let us know not just the whims or the wants of any one elected person who decides that they can do whatever they want whenever they want. There are a lot of families that depend on this casino industry throughout our region. And that leads me to another question. When we had Dr. Brabson as our guest, he stressed the importance of monitoring our existing health conditions. And I know that there are people with behavioral and mental health issues who, or their family members or friends or neighbors may be watching. And this has been a very difficult time for them. What healthcare services are available through AtlantiCare?
Senator Brown, I can answer that. And then Jim, you can perhaps catch anything that I may have missed. But, we have been urging our community to seek care and get care. We recognize that as this pandemic unfolded, and the state made decisions around restricting services, elective services, and outpatient services that could be done at healthcare organizations out of the safety concerns related to the pandemic, that we did see a decrease in people that were seeking care for those urgent or emergency care services. However, we never stopped providing those services. And like many other organizations, we became very creative and were able to provide urgent care and behavioral health and even primary care visits using virtual visits or telehealth, as you may have heard of that.
Well, I actually created and sponsored the bill to make it a reality. So yeah, I'm familiar.
And we appreciate your support in doing that, because
Happy to
that
do it.
removes that barrier from people, not needing to leave their house, but still being able to access the care from their providers. And we know that when people put off care, they put themselves at a higher risk of a more serious illness or complicating their existing medical condition, or perhaps even death. So, those illnesses, if they're not managed or prevented, could put people at even a higher risk of illness versus perhaps, the COVID-19 disease. So, we continue to encourage people to get back in touch and seek care with their primary care provider or their specialist if they see a specialist. We don't need to do that in person. We can accommodate that virtually. And I believe last week alone, about 35% of our primary care, urgent care, and specialty care visits were all done through virtual visits. And many of our behavioral health visits are able to be done virtually as well.
So if I hear you correctly, anybody who's listening to this who has any medical need, whether it's a family and friend for mental health care, an urgent care service, a regular checkup, whatever it may be, please call your doctor through AtlantiCare as well. If there's any need within the hospital, they will do it virtually first. But if you can't do it and they need to see you, they're seeing you. No services have been suspended, and everybody needs to understand that if you need the help, AtlantiCare is there to provide it.
Yes, that's correct. We are open fully. That's correct.
That's excellent. I guess the main topics for me were covered, but I would say, is there anything else you feel that you would like to share with our Atlantic County families about any topic that we're always looking to have our spirits lifted?
I'll start off, Senator Brown, and then hand over to Deb. But I think the main thing we all want to share at AtlantiCare is that we are open, we are safe. We want you to seek care and get care for any healthcare issue that you might have. And just rest assured that we've really taken extraordinary measures to help people get their care safely throughout the pandemic, and we continue to do so.
That's great. And Debra, anything?
No, I'll just add, certainly you can visit our website, which is www.atlanticare.org, or call our access center, and I can provide you with that number.
Please do.
That is 1-888-569-1000.
And I'm going to post the website as well as that phone number in our comments section, so any of the listeners, if they happen to miss it, they can find it there and reach out to get the care and the health services that they need.
Thank you so much for the opportunity to speak to the community.
Well, it's been wonderful, and both of you have very busy schedules, and your concern and AtlantiCare's ongoing concern for everyone here in Atlantic County is appreciated by me. As somebody who make it easier, my job easier, because looking out for families is concern number one, and when we have people like you and AtlantiCare, makes it much easier. So thank you both very much, and I hope you have a blessed day.
Thank you, Senator Brown. You too.
All right,
Thank
bye-bye.
you.
So we continue to advocate on behalf of everyone and their claims with unemployment. And once again, we're following up with labor. For everyone who contacted our office with a claim, and believe it or not, maybe before April 11th, they kept insisting that they won't go back. We kept fighting with them and saying they have to go back, and they have agreed that they will do that, and they are going to start looking more closely at them as well. When it comes to testing, Atlantic County is currently booked for testing through July 7th, but you may reserve your time by going online. I'm going to post the webpage in the comments. If you don't have internet access, you may call 609-645-7700, extension 4381. And again, I'm going to post that in the comments. AtlantiCare is offering testing at 3 locations with a prescription. Southern New Jersey Family Medical Centers are offering testing, COVID and antibody testing at 2 locations, 2 CVS pharmacies, Atlantic City, and I will post the details of each one of these in the testing section. We have a primary election coming up. I do not believe that it should have been forced to be done completely by mail. I think that if we can all stand next to each other in Walmart, we should give people the opportunity, if they want to, with proper distancing and the mask, going in and voting in person. However, you all know that is not the case, and therefore you need to get your application in and your vote in. I want to give a special thank you to our local Boy Scout troops in cooperation with Atlantic County Park staff who are honoring the memory of our fallen veterans and their spouses who are buried at the Atlantic County Veterans Cemetery with a placement of flags on their graves in preparation for July 4th. I thank you all for tuning in. I hope, as always, we're informative. And if you take anything from this, we brought you the data and the science. So often you see people spewing things out of their mouth. They don't take 5 minutes to understand what they're talking about. This wasn't an elected person or some politician telling you that the science and the data are telling us we can reopen. These are the leading professionals in our area. And they made it very clear. We have enough beds. We have enough ICU units. We have enough ventilators. We have enough PPE. We have enough doctors and nurses. Through their preparation, their hard work, and their professionalism, we are in a position where we are able to start reopening, and we just have to do it smartly and responsibly. And so that is what we will continue to fight for, because there are too many families who are suffering right now because of some of the orders coming out of Trenton that are not based in science. They're not even based in reality. And that's why we have to stand up for our families here and do everything we can. So one of the things, as somebody who's been activated for war on 2 occasions, absolutely loves this country, loves all of you, I say happy Independence Day. Enjoy your time with your family. And remember, we may not be perfect, but we are the greatest country on the planet. Thank you. God bless you.